Hello, everyone, and welcome to Hanging Your Digital Shingle, using social media to advance your career. This webinar is a joint effort with the Society for Pediatric Dermatology and Pediatric Dermatology Research Alliance. I'd like to take a moment to introduce you to your hosts, Dr. Jeff Yu, who's the Assistant Professor of Dermatology and Pediatric Dermatology at Massachusetts General Hospital and Harvard Medical School. Also with us is Dr. Lisa Arkin. She is the Director of Pediatric Dermatology, Assistant Professor of Dermatology and Pediatrics, Co-Director of the Birthmarks and Vascular Anomalies Center at the University of Wisconsin School of Medicine and Public Health. With that, I'd like to turn it over to Dr. Yu.
Great. Thank you so much, Jen. And welcome everybody to our first ever social media webinar. And we thought with the increased use of social media, especially in the realm of academic medicine or just to boost of our careers, what a great time it is to have some of the stars of social media in dermatology come out and talk to us. The reason we picked this panel is because everybody has slightly a different specialty on a different social media platform. So hopefully we can see examples of how all these platforms are used and exactly what ways that these things have been able to build their careers or build a career. So the first talk we're going to have is from Dr. John Harris. He really doesn't need a lot of introduction. He's better known as Harris Vitiligo if you guys follow him on Twitter, and it gives you a good sense of the kind of specialty that he does. He has been newly named the Chair of Dermatology at the University of Massachusetts Medical School, and he's just an excellent speaker and a great tweeter overall. So I'm excited to hear what he has to teach us about social media.
Thanks, Jeff. So this was a lot of fun to put together. I've never given a talk on social media, but as I started to put it together and build my slides, I realized I'm actually not very good on social media. Maybe I'm the worst speaker here tonight. But what I have done is built a website, and so I think I'll talk about that a bit in how that's really changed how I've practiced kind of medicine as well as academic dermatology. But so the title really is Digital Marketing in Academic Dermatology, because a lot of it is based on the website and then a little bit how we leverage social media. And since we're here, please follow me on Twitter if you can, and you can check out our website. I'll be talking a bit about that tonight. So I'm not going to lose this opportunity with all of you great PEDRA members. As Jeff mentioned, I'm the new chair of dermatology at UMass Medical School. We are recruiting. So we have a great place to practice dermatology. We're looking for adult and pediatric medical dermatologists, as well as scientists. And we want to build specialty clinics. And so this is a great opportunity for those of you who want to establish a career and expertise in a specialty. Let us know. So the first thing I wanted to do was really understand the role of the internet and the web in what I was trying to communicate. And that, for me, that was vitiligo. So I went to Google Trends, and this is a place where you can put in a word, a search word, and find out, really what are the trends occurring on the Google around what you're interested in. And so this is interest over time. I looked starting in 2004 to current day, and just looked to see when people were Googling the word vitiligo with other search terms. And this just struck me, really stuck out. In July 2009, there were a jillion people looking up vitiligo. And so I wondered what that was, and very quickly realized that was right after Michael Jackson died in June 25th, 2009. And I guess it shouldn't be too surprising that all the attention around vitiligo was really based on Michael Jackson. And that was actually fueled some of my approach from then on, starting at that point. We were able to look and see what other search terms were searched with the word vitiligo, and Michael Jackson actually was the third most common searched word with vitiligo. So based on that, I decided to try to generate traffic to my website and take advantage of what I knew from Google Trends. So the website started in 2014. I had some traffic, not a whole lot. But starting in 2016, this is when things really started to pick up. And this is a whole lot of fun. You can waste a lot of time looking at traffic and Google parameters and data. But this is when I wrote a blog called Did Michael Jackson Have Vitiligo? Starting right at the beginning of 2016, January 2016. And there is when all the traffic really began. And this was probably the best decision I made in terms of marketing, digital marketing. So this is more recent, starting like 2018. You can see that the interest in the website has grown over time, and there have been a couple spikes, and so it's interesting to kind of see what was related to that. One was a talk that I gave at the AAD about a new discovery we had made in March 2019, and you can see that resulted in a spike of interest. This was not anything I did. I didn't post this, but word got around and drove a lot of traffic to the site. And then in March 15th this past year, I wrote a blog on coronavirus and vitiligo, and that's, I knew there was a lot of interest. A lot of my patients were asking me, I have vitiligo. Does that mean I'm going to get coronavirus? Or if I do, is that going to cause more problems for me because I have, a wonky immune system? So I figured I'd just write a blog, and that drove thousands of people to the website in just over a few days. And so these are things to think about. What is the content? What do people want to consume? What can you provide that's unique? So you can tell I was not writing about psoriasis because nobody wants to hear me talk about psoriasis. You'll hear Joel in that aspect. But figure out what it is that you have to provide that people want, and then provide that, and then that can drive a lot of traffic and interest. So this is Stanislav Prodanov. He works at UMass, and he's our search engine optimization expert. And so I connected with him, and he told me really how to write blogs, how to communicate, how to share on social media to generate traffic, so that when you Google vitiligo research, vitiligo clinic, we're at the top of the list. And actually my name is there. And so if people are Googling vitiligo anything, they're seeing the opportunity to come see us and even visit our clinic. And so this has really made a big difference. If you Google Michael Jackson vitiligo, we ended up being the top hit in Google. And this is why we generate so much traffic. If you just Google vitiligo, we're like on the third page, but that's not too bad. And so this was actually something intentional that we went into with Stan. He's a great partner, and he was a lot of fun to work with. He really told me what to write, when to post. Post on a Tuesday between 11 a.m. and noon. That's when the most traffic will come to the website if you post on social media. So things, of course, that I never knew. But the important thing is I built a team to teach me how to do this, and I just did whatever they told me to do, and it's really made an impact. So social media, then, what I told you was really building a website and generating traffic. And so, the way I've used social media is to really amplify the reach of that website, and not so much to really engage with social media, but I kind of used it as a tool to generate more traffic. And there are a number of groups on Facebook. This one's called Vitiligo Life with over 22,000 members. And I became a member, and this was an opportunity that I had. So as a member of Vitiligo Life, I just keep an eye out for posts from patients who've got interesting questions. So this is one patient that shared this post that said she's never seen outlined patches of her vitiligo with erythema. So she said she has these red lines around the edge of her patches of vitiligo, and it's really itchy, and she doesn't know what it is. So I took the opportunity and just commented and said, this looks like inflammatory vitiligo, which is a really uncommon subtype that even lots of dermatologists don't know about. But she was worried about this, and I was able to say, hey, this is just part of your vitiligo. And then I was able to link it to one of the blog posts that she could visit. And with this many members, lots of people, you post something like this, it generates a ton of traffic to the website. Here's another one that your group might appreciate. This is a picture of a 2-year-old with this patch on the leg that they were worried is this vitiligo. They had a family member with vitiligo. And of course, I recognized it right away as most likely nevus depigmentosus. And I had written a blog called Maybe It's Not Vitiligo, talking about the differential diagnosis for people like this who are just wondering. And again, an opportunity. Now, these were not intended really. This is more for fun. This is just to provide help. But actually, lots and lots of comments and posts like this have generated a lot of trust on these platforms. So a lot of doctors or a lot of people are on there, and they think they're snake oil salesmen and just trying to sell things. And here I am just trying to help out. And I've been able to become a part of the community, and they trust me. So occasionally I'll share blog posts like this. So we did a phase 2 clinical trial and published this not too long ago. And we're able to share a blog post just to generate interest and get people excited about what we're doing and what's happening. So this was a phase 2 trial for topical ruxolitinib with great results. And then actually I learned from social media. So by hanging out on this website, I can see Living Dappled is another one of these sites where somebody posted, has anyone tried laser hair removal and did it affect your vitiligo patches? And I actually don't know the answer to this. My patients ask me this all the time. And this is just a great way to do research, right? A lot of people were posting, oh, I had hair removal. It didn't do anything, didn't cause any problems for my vitiligo, or I had it and it expanded it a little bit or irritated it. And so I can learn as well. So again, collecting data, we can look and see which posts were most popular. Here are a couple Instagram posts. I don't know how to use Instagram still to this day, but the IT team at UMass started a profile for me, so they're sharing on my behalf and generating some interest here and there. I started a company called Valeris Therapeutics, and I had posted about that, and then they shared that, and that generated a lot of interest. So it's kind of interesting to look what people are engaging with and what they're interested in. This was the coronavirus post that had a lot of engagement as well. So you can spend a lot of time looking at data, and I'm a data guy, and this is a lot of fun. At any one point, you can see who's on the website at that time. So at this point, there were 12 people looking at the website from all over the world. And maybe it's not vitiligo was the most popular post at that time. And I didn't even realize this would be really that popular when I wrote it. But just telling me what people want to engage with. You can see that most of the traffic to the website actually comes from mostly Google, in organic search. 7% is direct, and then a little bit from social media. And that social media is mostly Facebook, mostly because I'm old and that's what I do. A little bit from Twitter. You can see where people are coming from to the website. So this is where people are Googling about vitiligo. You can see the US, definitely India. India is the second most common country trafficking to the website. There's a lot of interest in vitiligo there. And so you can see where there's worldwide interest. And I could even write, blog posts specific to regions, as I learn what people are interested in. So I've been tracking traffic over time. My second year, we had over 100,000 people visiting. Now we have over 1 million people visiting per year. And interestingly, UMass tells me all the time, the ITT team, that at all of UMass Med, my whole entire medical school, our vitiligo website is the number one site at the school. And they're really excited about that because as more traffic comes to the vitiligo website at UMass Med EDU, it elevates all the other websites at our school. And so they're really excited about this on Google searches, et cetera. And we're recognized for our blog posting a couple of times. So I can drill down and see really what the interest is. You can see the Michael Jackson vitiligo is the best blog I wrote. It generates 27% of all traffic back in 2016. Maybe it's not vitiligo has generated a lot of interest as well. And they're hanging out there a long time. They're spending minutes on the webpage, which is a good sign. So just to end with a few examples of how, I've used Twitter and how it's really helped social media. This is a tweet. I just found a paper called Star Particles for Enhanced Topical Drug Delivery and Vaccination. I just shared it and said, cool. And the authors of this paper got in contact with me not long after and became collaborators. And now we're working on starting a company with venture capital funding and everything. So this was this is a great tweet. This is probably the most valuable tweet I ever shared. And it was just, that I thought that this was a cool paper. And then using it, as I mentioned, as chair of dermatology and recruiting faculty and all number of people to join the team at UMass. So this has been an opportunity. I shared this tweet and got a lot of responses from all over the country of people who are interested in joining us. So I'm really excited about that. And we're working through talking to all of them. Facebook used that as an opportunity and just posted in the board certified dermatologist that we were recruiting. They told me I should share to the Career Center board that I didn't know about. So I did that and heard from a lot of people who were interested. So this has just been really very valuable to me in ways that I'd never imagined. So I use the website and all that traffic to advertise clinical trials. Of course, when we do clinical trials, we need to recruit patients. And so the IT team recommended that we put a sign-up opportunity for people to put in their name and email so that we could contact them with a newsletter when we're doing trials. We have 8,700 people signed up for that. So with one newsletter now, we can hit thousands of people and let them know what's going on. So that's it. I think there are a lot of benefits to using social media and digital marketing. We've actually had generated a significant amount of philanthropy through this. Staying in touch with friends as Misha Rosenbach, that I'm able to see his tweeting passions. Patients come to my clinic from all over the world, and that is largely because of the website and what they see there. Recruiting, it's just a whole lot of fun, and developing collaborations. Maybe there are some downsides. I get emails from people every day who are looking for me to answer, to read, pages and pages of their medical history and help them with vitiligo. And so that's challenging because I can't do that anymore. This is the digital marketing team that really are responsible for helping you as much as they have. I mentioned Stan, but Masha, David, and Jyoti are really have been fantastic. All right, that's it. I don't want to take any more time. Happy to answer questions when the time's right.
Great. Thank you so much, Dr. Harris. That was amazing to hear about your website, and then your Facebook work, and then your Twitter work. I think there's going to be a lot of questions for it. We're going to keep questions at the end, you guys, so we can move right along and make sure that we give every presenter the suitable amount of time, and the appropriate amount of time for them to present their information. So without further ado, next up is Dr. Daniel Sugai. He did his residency at Harvard Combined Dermatology Program. That's where I met him first several years ago. And then since then, following him on social media, one day out of the blue, he just starts popping up on my Instagram feed, and he's now everywhere. So not only is he on Instagram, he's also a very prolific TikToker. I don't know how many of people on this list are on TikTok, but he's really made use of that, not just to promote his own practice, but also to promote the field of dermatology at large. So without further ado, I'd like to welcome Dr. Daniel Sugai. Daniel Sugai, thank you so much.
Okay, thank you, Jeff. Appreciate it. I'm going to share my screen now. All right, so nice to meet you guys. I'm Daniel Sugai. Thank you, Pedra, for inviting me to speak tonight amongst some powerhouses. So really honored to be here. All right. So just real quick, diving in, I am affiliated with YouTube, TikTok, and Amazon as partners. Really excited to share my story here. And you might be wondering, why is this guy wearing a TB12 Buccaneers jersey? And his kids and wife are in other jerseys. So my story dates back to Hawaii. I'm from University of Hawaii. I did my medical school training at University of Hawaii. And as Jeff mentioned, I went to Harvard for their combined dermatology residency program. And after, while there, I was able to watch Tom Brady play a bunch of games, and moved out to Seattle and still remained a New England fan, and now rooting for Tom Brady this past Super Bowl. So this was our family picture from Super Bowl Sunday. Congrats to the Buccaneers. But my wife and I, we trained in Boston. She's a hospitalist in the area, and we have 2 kids. And before February of 2020, I didn't use social media. I was on Facebook that I barely used, and I didn't have Instagram. I didn't know anything about Instagram. And 2 years leading up to me starting Instagram, my medical assistant was saying, "Hey, Dr. Sugai, I really think you should start it. You can't fight social media." And she was totally right. And one February lunch break, we just went in, and she said, "You know what? Let's just make you a profile." And I said, "Okay, let's do this." So, I started Instagram pretty much a year ago, and it was a steep learning curve. I didn't know what to expect. I was looking at other dermatologists on social media or on Instagram and try to look at the content they're producing and trying to navigate through all this. And then this was the start of the pandemic, and just starting social media during a really weird time was a roller coaster for sure. It just has ups and downs. And I started a YouTube channel in April when we had our lockdown, where I was only working 1/2 day a week. And it was really hard for me. For physicians, we really like control, and to have no control, very little control during this time where, we didn't know what was going to happen. I was only working 1/2 day a week. From seeing 30 plus patients 4 days a week to only working 1/2 day a week was a huge change. So one day I just propped up my phone and I started talking to the camera as if they were my patient. My first YouTube video was about moisturizers. And then the second one was about retinoid creams, and people, gave really good feedback, and I just kept it going. And, the channel's grown, thankfully, and I was having a lot of fun with social media. And so in June, I started TikTok, and I'd say I wasn't the earliest adopter of it, but I was pretty early on, where a lot of my colleagues weren't on it yet. And I started being silly and started adding more humor into that versus Instagram was a little bit more serious and formal back then. So just going to jump into it. So Instagram organically grew to over 32,000 followers in the last year. A lot of digital marketers will come up, social media marketers will come and ask you if you want to buy followers. I did not pay any money for my followers, and just finding a way to brand myself through Instagram, which is totally free. So just taking advantage of that was huge. I used their different platforms within Instagram, like IG Reels. They came out with their own mini TikTok on Instagram. So I was able to jump on that early on and recycle my TikToks and make it into a reel. I used Instagram Live to talk about sunscreen or COVID skin manifestations. And, I even did an in-feed post on COVID skin manifestations. And the really cool thing, the power of social media is that it had a really good reach, and it had other dermatologists around the world reshared it in 5 other languages, which was amazing. So that stuck in my mind from last summer. Did a campaign on Instagram to thank our inpatient nurses at our local Seattle Children's Hospital, as well as the adult hospitals, working with other skincare brands to donate moisturizers to our nurses to thank them. And which was really neat was that it sparked other people around the country to do the same. And they would tag me saying, "Oh, thanks to Dr. Sugai, we're doing it as well," in their local communities. So I thought that was really neat. So, networking with other dermatologists, even estheticians, we do myth busts on a monthly basis, working with other skincare brands and scrub brands and such. Those are all just nice, other extra things. But the main thing is just really trying to give out really credible information from, a board certified dermatologist. Recommendations or tips that I would say is post regularly. Like Dr. Harris said, looking at the times where there's the highest engagement, look at your analytics and see where your followers are. So a lot of my followers are on the East Coast. So I've actually shifted my posting times to more 10:30 a.m. my time. So I found that was the biggest engagement when I post on Instagram. Being genuine, having personal touches in your photos is always nice. Using colloquial language in your captions, being too formal, being too much of a robot, not a good thing. So be genuine. I used to throw in a lot of family pictures in my posts, but you have to be careful. There's impersonators out there, and whatever you put out there can be screenshotted, can be recycled, can be reshared. And so I just didn't feel comfortable anymore posting pictures of my kids as much or anymore, even in my stories. Okay, YouTube. So like I said, I started in April. After 10 months, it's really grown, and just as a nice strategy of trying to increase your reach even further. There's a lot of bad information on YouTube, especially around this pandemic with the coronavirus and such. So, skincare is the same. This 2020 was the year of skincare, and everyone has made it a hobby. They're at home, they're working from home. Patients and viewers have said they don't like the way they look on Zoom. They want to work on their skincare. So there's a lot of engagement and interest, and I've already accumulated over 1.2 million viewing minutes on YouTube so far. And, global audience from, the UK to Asia, Australia and such. And I'm also using it as a platform to spark interest in medicine. I've started a Dr. SPF series where I post Zoom talks with other schools. So I actually do talks with virtual talks with students from around the country, UC Berkeley, back into my home state of Hawaii. I'm doing some talks with them, the Pre-Med Association, to answer questions about medicine, just to spark some interest. And this year has been a phenomenal year for, they call it the Dr. Fauci effect. Lots of people are applying to medical school at this time. But just a strange time, but, just using the, this year as a way to just catapult your social media presence for sure. It's really helped with my engagement with the pre-med talks as well as skincare. TikTok. So TikTok has been a really fun ride. I mean, this is TikTok's like the Wild West. There's like so many crazy skincare trends out there. There's people taping potatoes to their faces and using menstrual blood face masks to cure their acne. I mean, there's so much bad information that I'm there to also add some entertainment, but also education and credible education. And specifically, I've been trying to start more COVID vaccination education as well, which is a very controversial topic, as you guys all know. It's a very divisive time. But I'm, as a physician, I wanted to just definitely try and branch out and talk about that as well. And in doing so, my page has grown a good amount. And so I'd have to say that I wonder if you guys are able to see this here, that you can get a good amount of engagement here, that 783,000 likes, cumulative likes here. And I've also been recruited as a TikTok partner to do a hashtag Learn on TikTok campaign. So I'm just talking about skincare, ranging from acne to, I can talk about vitiligo and psoriasis and such. So it's a nice way to reach the masses through in a fun way on TikTok. Okay. So here, the downsides, the challenges of social media. So, dealing with the trolls on a daily basis is definitely a real thing. And I always say, do not engage. It does not end well. I've been told that you have trash recommendations. You're a sheep for recommending mask use or talking about the vaccination. You've been paid by the vaccination companies or the government to talk about these things. You're going to get these things when you have a large reach. Another controversial topic has been isotretinoin, and that has gotten ugly. The AAD has done a good job in working with Instagram to close down those profiles that were attacking dermatologists through DMs, leaving comments on our Yelp pages, WebMD reviews. I've also gotten bad reviews because of people who've seen my isotretinoin posts, as well as my colleagues who've done the same. There was a big cancel culture campaign against us. So I would say be careful when you use the word myth in your posts, because it can be very sensitive. Like isotretinoin, there are patients who think they've been permanently damaged from this medication, and so when you say the word myth, it's very hurtful, and because to them this is the reality. So just be careful with using that word. It can become very inflammatory and a big mess, especially also with vaccines too. I mean, I've had a anti-vaxxer influencer who my post had almost 1 million views, and she took my post and put on her story and told all her followers, 100,000 followers, to come after me. And things can get pretty ugly when you are talking about these things. But for me, I felt like it was important and it was worth that risk. Always create boundaries. I always say it's skincare education and never medical advice. Do not answer those DMs where they're sending you pictures or asking you for personal advice. The other thing is that you have to manage your time with your clinical responsibilities and your personal life. I spent numerous hours in editing videos, filming, and such, so it becomes a second job. But the benefits, you are reaching a global audience with a single post. As you can see here, I talked about vaccines. It had 23,000 likes, and it's really just seeing the comments from people saying, I was unsure of getting the vaccine, and now I'm feeling better about getting it. I will get it because of your post, or I'm really excited to have my parents get vaccinated because of your post. Those things are really make you feel good about that. You're making a difference, and you're reaching hundreds of thousands of people with just one post. And people have really appreciated me as a male dermatologist talking about skincare and normalizing it and increasing skincare awareness for men, and men DMing me saying, hey, I'm using a retinoid because of you. Those things, that's really neat. And also seeing people really appreciating my pre-med advice videos as well. In medical school, we talked about irrigation and surgery. The solution to pollution is dilution. That was our saying. And so I feel very proud joining my colleagues on Instagram, especially since we don't have it in-person conferences. It's been really nice joining and collaborating with dermatologists and trying to drown out all the fear-mongering, the marketing tactics, all these silly devices that they're trying to have patients purchase. We've been trying to debunk those. So it's been really a fun time doing that as well. So I'm using the word myths here for things like devices and, the term medical grade skincare. We've jumped on that. But I would say, again, be careful with that term. I have been now seeing more patients filling my schedule now and saying that they found me on their For You page or Explore page on TikTok and Instagram, which is really neat. Now I'm starting to see patients flowing in from finding me on social media, which is, I think it took almost a year before patients started to act on it after seeing my page. partnering with brands, trying the newest and latest and most innovative products from them. I know this will never replace clinical income, but it is another stream of income, monetizing your pages, doing affiliate marketing, consultation, compensation, and such. So those are the other benefits, but I feel like the biggest is just really disseminating good information to the masses. All right. So thank you for having me, and really enjoyed talking to you all, and really appreciate Jennifer as well in coordinating this. So hope to connect with you guys as well. Here's my email and Instagram too. Definitely follow other fellow dermatologists and send a DM sometime. All right. Take care, guys.
So we're going to start with the question and answer period here. And we have several questions in the Q&A box, and we are going to go through some of them. I know that some of the panelists have already started to answer some of the questions, but I want to make sure that everybody in the group and that's attending the webinar gets to hear it if you did not have a chance to read it. So I'm going to do these questions that have already been answered first before we come to some of the live questions. And I know that we have some other questions that have been flowing in through the chat as well as the Q&A box as well. So one of the first questions we had was, do you have a separate Facebook account for personal and professional use when you engage in the public groups? And Dr. Harris responded, I wish I did actually. It's too late for me. I use my personal account for Facebook posts and somewhat selective who I friend there. If I had to do it again, I would have created a separate profile altogether. Not sure how to do it now.
And for me, my Facebook is totally personal. I am in the board certified dermatologist Facebook group with my personal account, but I'm not in any public groups at all for Facebook. My Instagram and TikTok, of course, are professional.
All right. Next question from Dr. Maria Teresa. And for Dr. Harris, how much time should be devoted? And I think this question is for all the panelists. How much time should be devoted to social media in order to obtain results, especially for those of us, and I think the majority of us, who probably don't have access to an IT team at either our respective practices or at our institutions? One of the questions or one of the answers that Dr. Harris said was, I would do it in your spare time and see where it goes. The more time you spend, the farther the reach, but there are so many things that will occupy your time. You can't overdo it. It's fun. Try to keep it that way. And I think, Dr. Sugai, you kind of mentioned this a little bit as well about in terms of how much time that you spend making these YouTube videos, editing them and making the TikTok. And I'm sure doing it again if something doesn't go well. I would love to hear from you and time you guys are spending on social media and whether you feel like you should spend more or less time.
Yeah, for me, I have 2 young kids, and my wife is a hospitalist physician, and it's been really hard to balance. And so it's always this ongoing dynamic thing. And I agree with Dr. Harris that it's on the spare time. And it's usually like at the end, after I get put the kids to bed, I don't like them seeing me on my phone. And it can be a couple hours a night of editing or content creation, brainstorming, writing captions for Instagram takes a long time, writing those long captions. So it is something that I do want to shorten. I want less screen time, but as your reach increases and your followers and the demand for your time increases too.
Have you ever run into problems when you're providing medical insight on social media? In other words, do you provide a disclaimer somehow, just thinking about how to keep the stress level low while wanting to help at the same time? And I had, a similar question for Dr. Harris as well, especially, when you see these posts, and I'm a big, and I'm into contact dermatitis, and I see these posts about either false advertising, like what Dr. Sugai is saying with, people using 50 skincare products and telling me, oh, they're only clean products only. I just want to go out there and say something, but I don't, because I don't want to engage in this long conversation with people online. And I would love to provide medical advice because I think there are some very glaring things that you can help with, but you also don't want to be medical legally, responsible or anything like that. So how do you kind of juggle those things when you're on social media?
Yeah, for me, I've learned not to argue with anybody. So you saw that the post that I put up, if someone came back and said, that's not nevus depigmentosus, I guarantee that's vitiligo. Like, I wouldn't say, no, I'm the expert. And then that's all it is. I'm throwing it out there. I'm trying to help somebody. You can get sued over anything, and you can be paralyzed by fear. I mean, you can not do anything because you're afraid of getting sued. I try to be just practical, and I feel like anything I say out there, I could easily defend as, my intentions were good. That doesn't always protect you, but life is full of risks, and I take some of them. And so far, so good.
Yeah, for me, I definitely do put a disclaimer in my YouTube videos. This is not medical advice. Like I mentioned before, I don't engage in any DMs where they're sending me pictures. I don't even open it up. I also, I recommend over-the-counter things, and I when people say, I might do a general thing like say PCOS, might recommend oral contraceptive pills. The next question, of course, they're going to say, which ones would you prescribe? I just stop right there. Done, right? Don't go any further. I try to stay away from prescription medications. It could be a broader category, like I will give retinoids for acne, but I will also put in my video, do not use if pregnant. I always throw that little thing, and you might notice in my videos as well, just in case, right? So, yeah, I'm pretty. I use the word education, and I try to stay away from the word advice as much as possible in my videos and also in my captions.
And a question from Dr. Colleen Cotton. Are there any specific tools you recommend to help manage your posts? Do you write any ahead of time and post later?
Yeah, for me, I do it ahead of time as I'm, the night before I'll write my captions. I will just do it. There's probably more sophisticated apps out there, but I'll do it in my notes app on my phone, and then I'll copy it to Spacey so it comes out in a nice caption format, or paragraphs are broken out nicely, because Instagram wants to make things hard for you to make things nice and organized. So I use that app Spacey, and I use InShot for my videos. I recommend that app for any video, whether it's TikTok, Instagram, YouTube. That's a great app for if you want to get into the video game.
Yeah, I'll write a bunch, as if I get some time over a break or something and everybody else is busy, and I can sit down and just bang out a few ideas. I'll save up ideas, and I get asked this, these 3 or 4 questions, and this hasn't been answered yet. I'll write them, and then I won't share all 4 at the same time. I'll share them over the course of a month or 2, and that helps space them out. I like blog posts. The website, for me, blog posts are forever. So I wrote posts 5 years ago that people are still reading today, as I go on and see. A lot of the social media stuff gets lost and it's gone. So I've invested a lot more time in my blog.
And time for one last question here. And I think this is a great one. What's the best way for medical students and trainees to use social media? So I think it's easy for some of us who have niches and who have a career path and say that this is my topic of interest and this is what I'm going to, talk about. But what about medical students and trainees who may still be exploring the field of dermatology or exploring the world of medicine in general? What advice do you guys have for them?
Yeah, well, for me, I have my medical assistant's applying to medical school right now, so she's a pre-med, and they asked her interviewers are asking her, do you have anything on your social media that could be potentially harmful? Mm-hmm. They are probably looking them up, so I would say just be very careful. If you're applying to residency, I'm sure. I mean, we have some big guns here. They probably would be looking at your, LinkedIn or such. So I would just say, just be very careful. I know there are some dermatology residents who are doing very well in the social media game with, millions of followers. They're doing very well. But I would say just make sure that your institution is okay with it. And I've reached out to them, and they've all spoken to their program directors. And I would, if I didn't have, I was never on my phone to residency. I was just thinking, I don't know how I would be as a trainee with social media. I mean, it's just so much demand. It's just so much stimulus that I wonder how it's going to be. I don't know how it would be being a trainee with social media and being with it so active too. So
agree. Second that. Be careful. It's just one bad tweet can make everything go bad and ruin everything.
Great. Thank you guys so much for those wonderful presentations and the excellent question and answers. I'm going to turn it back over to Jen.
Thank you all so much for joining us this evening. I would like to thank our speakers, Dr. Harris and Dr. Sugai. Thank you so much for putting the time and energy into those wonderful presentations. I would also like to thank our hosts, Dr. Jeff Yu and Dr. Lisa Arkin. I would also like to thank the Society for Pediatric Dermatology Junior Faculty and Fellows Committee and PEDRA's Early Investigator Committee.